Understanding acute cholecystitis. When your gallbladder needs immediate attention, we often take our digestive organs for granted until they start acting up. Among the most painful and potentially serious issues is acute cholecystitis, a sudden, severe inflammation of the gallbladder that demands prompt medical intervention. If you've ever experienced intense abdominal pain that didn't go away, it's important to understand what this condition is, why it happens, and why it should never be ignored. What is acute cholecystitis? To understand cholecystitis, it helps to know the role of the gallbladder. This small, pear-shaped organ sits just beneath your liver and stores bile, a digestive fluid produced by the liver that helps break down fats. Acute cholecystitis is the sudden swelling and inflammation of the gallbladder wall. In the vast majority of cases, over 90%, this occurs when a gallstone becomes lodged in the cystic duct, the tube that carries bile out of the gallbladder. When that duct is blocked, bile has nowhere to go. It becomes trapped, builds up, and creates pressure within the gallbladder. This pressure irritates the gallbladder walls, leading to inflammation and, frequently, a secondary bacterial infection. The warning signs. The hallmark symptom of acute cholecystitis is severe, unremitting abdominal pain. Unlike the occasional indigestion or cramping that comes and goes, the pain associated with cholecystitis is persistent. Common symptoms include sharp, intense pain. This is typically felt in the upper right part of the abdomen, just below the rib cage. Pain that radiates. It is very common for the pain to travel to your right shoulder or between your shoulder blades. Tenderness. The area will often feel extremely tender when touched. Fever and chills. These are signs that the body is fighting an internal infection. Nausea and vomiting. Many patients experience a sudden onset of nausea after eating, particularly fatty meals. Why it's a medical emergency. Acute cholecystitis is not a wait and see condition. If left untreated, the trapped bile can cause the gallbladder to become infected, gangrenous, or even perforate, rupture. This can lead to life-threatening complications like peritonitis, infection of the abdominal lining, or sepsis, a systemic inflammatory response to infection. If you suspect you have acute cholecystitis, you must seek emergency medical care immediately. The path to treatment. When you arrive at the hospital, medical professionals will typically confirm the diagnosis using blood tests to check for markers of infection, and imaging tests like an ultrasound or a HIDA scan to visualize the gallbladder and identify any stones. Treatment is focused on stabilizing the patient and resolving the inflammation. This usually involves hospitalization. You will need to be monitored closely. Intravenous fluids to prevent dehydration and keep you hydrated while you are unable to eat. Antibiotics to clear up the bacterial infection. Pain management, medications to control the severe discomfort. Surgery, cholecystectomy. In most cases, the definitive treatment for acute cholecystitis is the surgical removal of the gallbladder. Once the gallbladder is inflamed, it is prone to recurring attacks and complications. Most surgeons prefer to perform this procedure, often laparoscopically, or keyhole surgery, during the same hospital stay, as the body generally functions perfectly well without a gallbladder. The bottom line: your gallbladder is a vital player in your digestive health, but it isn't essential for survival. If you experience sudden, unbearable pain in your upper abdomen, don't brush it off as a bad meal. Listen to your body, seek medical help immediately, and get the care you need to prevent a serious health crisis. Disclaimer: this blog post is for informational purposes only and does not constitute medical advice. If you are experiencing symptoms, please consult a healthcare professional or visit the nearest emergency department.